Hi, we're here with Tara to do the non-surgical rhinoplasty. I just want to give you a little bit of information about the procedure. A lot of people have a bump in their nose, and we can disguise that bump by adding filler to the bridge of the nose, and it makes it look nice and straight. And we're also going to do a Tinkerbell lift on Tara, which is just lifting the tip of the nose. And actually with filler, it makes your whole nose look smaller. So stay tuned and watch our procedure. Okay, so the first thing we're going to do, Tara's been numbing on her nose. We have a really great numbing cream. This procedure has very little discomfort to it, believe it or not. So she's been numbing. I'm going to go ahead and clean her nose one more time with alcohol. We try to minimize any chance of infection that we can. My product of choice for the nose is Voluma. It's the most structured product that we have, and it really holds its shape nicely. The first time you get the non-surgical rhinoplasty with Voluma, it'll last 3 or 4 months, and then you'll start seeing a decrease. So we always want to come back and do another application, and then it seems to last much longer the second time around. Okay, so I'm going to start right here at the bridge of the nose, and I'm trying to disguise this little hump and just make her nose look nice and straight and kind of Romanesque. So let's go. So I'm going all the way down to bone, and then I always aspirate, which means I pull back on the plunger to make sure I'm not in a blood vessel. And like I said, this is Voluma. It's very structured. It's a Vicross Juvederm product. It's not going to absorb a lot of water, so you won't get a lot of shape change afterwards. With lips, we do the Ultra Plus, which does absorb water to maintain that plump, but we don't really want plump here, we just want structure. I like to overfill it just a little bit to compensate for any swelling we see at the end, and just to, if it settles, it still settles with the shape I want it to be in. I want to remind you guys that the Juvederm does have lidocaine in it, so as we inject, she gets numb on the inside, so the procedure it just gets more comfortable as we proceed. Okay, so now we're going to start the Tinkerbell lift, and that's where I put product right in the tip of the nose, and it's just going to kind of give her a little lift like that. I know if you're looking at this video, you've probably looked at our Instagram and you've seen the befores and afters. So when the tip goes up, that's called a Tinkerbell lift. So here we go. That looks good. One more little bolus here and then we'll be done. Now Tara, I don't want you to touch your nose. No glasses. Don't wear any sunglasses or anything for a few days if you can help it. If your glasses fall on the side of your nose, then that's okay, but if your glasses lay on the bridge, you've got to avoid them. And you've got to tent your mask, nothing really tight around your nose for the next few days until the Voluma settles in, because it can still be sculpted and moved, and we don't want that. Okay, here's the mirror. Let me take the shiny off. There you go, take a look. Oh my God. This I can tell. Okay. So that's how we do our non-surgical rhinoplasties. So click on the link below to schedule your non-surgical. We'll see you soon.